Thank you so much for joining us. This is the portion of our time where we get real. I am here with Dr. John Riski, and my name is Alicia Reve. And during this portion of our time, we're going to just have more of a conversation where I've got a few questions for you. And I'd like to just jump in with something that you already started with a little, which was what or who motivated or inspired you to do research in the field of craniofacial anomalies?
I think it's a process.
Okay.
And I think a lot of it started with the experience at the University of South Florida. They demanded that we measure everything, that we knew the outcomes of every clinical process. And the experience at the Mailman Center, where I was still intrigued with autism. And I was asking the question, why is there echolalia?
Right.
Why is there echolalia? And I had a theory, and my theory was that they became echolalic when they didn't understand, when they got to the level where they didn't understand what you were asking. So I did a relatively simple, I thought, elegant study at the time where we videotaped them, we recorded what they did, and we just used the Peabody Picture Vocabulary Test. And as it turned out, the amount of echolalia went up as their knowledge of the pictures went down. So I felt that I had proven my null hypothesis that, in fact, echolalia was related to a lack of knowledge. So that was one of the things. But then the experiences at Florida, where my first job there was a research assistant. I was just mentored, and I was just, I don't know if enamored is the right word, but I was impressed with people, the questions that they were asking, and the way they thought, the way they developed their protocol for studying different things, whether there was a lot of oral sensation and perception going on, studies going on at the time, because we realized we knew a lot more about how the fingers could perceive textures and things like that. And we had no idea how the tongue or the lips perceive textures. So it was actually a grant that they had. And I think that's what kind of kept things going. But as a clinician, it was how does a clinical outcome, how do we measure that clinical outcome, especially if you're putting a child through surgery. So that's where I really got into more of a clinical research. Since so much of these surgeries are done for speech, it's the onus of the speech pathologist to be able to evaluate the outcomes of these surgeries. So that was the process in developing.
Yeah. So my follow-up is what keeps you motivated in your field. And I've been to the Children's Healthcare of Atlanta website and looked at the Craniofacial Center. I guess it's a promo video. And I don't think it's hard to, when you see those positive outcomes, I don't know that it would be hard to stay motivated in what you do, but I don't know if you've got a particular patient or a particular story about what keeps you going with the long track record you have in the field.
It's the keep living long enough and you'll have a long track record too. It's being able to look each patient in the eye, look the parent in the eye, sign off on an insurance claim when I need to, that we've done everything we can to verify that the surgery that this patient is going to have or that the therapy this patient is going to have is valid, it's reliable, and there's value to it. And I think that's what it is. Then it's for my own kids. Both my wife and I want to be a good example. We want them to see the things that we have passion for and help them have experiences where hopefully they will have passion. And then it's just the field. I want to be there to do for young clinicians what people did for me decades ago. Instill that passion, help develop the skills. And then some of it is just the camaraderie. I end up working with clinicians that I know from around the world, sometimes around the country, that have that same passion. So it's all of those things kind of rolled up in one, and that's what really keeps me going.
Wonderful. We had talked a little bit in the previous sessions, and you had touched on this, but the field of speech pathology and the education that we receive as graduate students is very broad. And you talked a bit about hoping that we all get that aha moment that tells us where we should specialize and where we should, really focus our time and energy so that every day feels like a day at the beach. Do you feel like, or I guess how would you suggest that students maximize their opportunities to find their aha moment when our education is so broad?
It reminds me of what they told me when I got to Duke, and all of a sudden I was involved in the tenure process. Mm-hmm. Dave Sabiston, who's a cardiac surgeon, was a chair of a surgery that we fell under, and he'd say, John, tenure is a 24-hour-a-day pursuit. And I had not just research mentors at Duke, but I also had clinicians that I admired for not only the quality of work they did, but the volume of work that they did. So what I would tell young students today is, right now in your life, this is kind of a sprint, and you need to get as much as you can out of this sprint. You need to be aggressive in looking for opportunities, even if the opportunity is one you decide is, that's definitely not an area of the field I want to go into. Mm-hmm. It's nice to be able to cross things off. But I think the student has got to be aggressive, and they have to put a lot of time in. It's going to be worth it in the future. I mean, there's nothing worse than feel like you've just spent 6 years in school, $1,000 in possible school debt, and you're doing something you don't have a passion for.
Right.
I would put the time up front, find people that you can shadow, see what their life is like, and see if this is something where you fit in, kind of like maybe the students did when they came here to the University of Georgia campus. Mm-hmm. It's not just Mark Richt on the TV anymore. It's not just the Bulldogs. They come to the campus and feel like, I belong here. Mm-hmm. And I would hope that the students get to that same experience as they work with somebody. I could see myself working here, seeing these kinds of patients, doing this kind of stuff. These are the challenges that I want. And it doesn't always happen easily, but it will happen if you pursue it.
I think that's good, solid, actionable advice for all of the, upcoming graduates and maybe people who are out in the field as well. Which leads me to wonder, and you did touch on this as well, but for new clinicians wanting to do a specialization in craniofacial anomalies, you talked a bit about shadowing, and you talked a bit about just going after any opportunity to get a fellowship or an internship. What kind of continuing education, or what would be the level of education that I would need to get on a team?
All good questions, and I'll back up even before that. It seems like every year I am approached, sometimes it's a friend of a friend of a friend, a chemist got her degree at Emory, decided she is not cut out to be a chemist, but she came across speech pathology. She spent a couple of months with me. She's finishing up her degree at LSU in speech pathology. And a young girl who had a head injury, 15 years of age. It was the rehab experience that she had at Children's, decided maybe I should look at speech pathology. Spent some time shadowing us and decided this is something I really want to do. Mm-hmm. So I think most clinicians are willing to take somebody that can shadow. As we were kind of talking before in practicum, it's not just a phone call and a handshake mm-hmm. anymore. You actually have to sign an observation contract. You have to complete a health screen. You have to go through a clinical orientation. Small things. It's a lot less than you have to do when you're doing a practicum, but there's a process involved in that. So yeah, find people. Mm-hmm. Talk to other clinicians. Who's nice? Who is going to spend time? Who's going to ask me questions? Because I've told you I do that because I want to find out what somebody knows, and if they don't know, then I'm going to make sure that they get a lot of audio visuals to kind of fill in that knowledge gap, or they learn why all 12 cranial nerves are important. Because I'm going to make sure when they're watching me and we're testing a patient that I'm making sure that they watch how we test each cranial nerve. Certainly join NISHLA, the Student Association. Become a student member of Special Interest Group 5, Craniofacial and Speech Science. Attend ASHA. With that membership in Special Interest Group 5, you get discounts to all the presentations. This year, Special Interest Group 5, I can't even remember how many special presentations we had, but there were a lot of presentations by experts in cleft and craniofacial at ASHA. Consider joining the American Cleft Palate Craniofacial Association. There's student memberships for that are nothing. And you get discounts in going to that meeting. You also then, both of the listservs for those two groups are membership only. So immediately then you have email access to these experts around the world in cleft palate, speech science, craniofacial disorders. But those are some things that are fairly inexpensive and a student can start working on this afternoon.
Awesome. Well, that's great. I also wanted to talk to you. You've got over 70 publications, and if you look at the list of all of them, you've done a lot of work independently and you've done a lot of work collaboratively. And of course, your team at Children's Healthcare is also, it's a wide range of expertise that you have there. I was hoping you could talk to us a little bit about the role of the speech pathologist on a team and how to work well with people who have different experiences that are very valuable while still being able to own your own piece.
The thing that impressed me about the speech pathologist's role on a craniofacial team is that it was different than the speech pathologist's role working on an aphasia team or some other teams that I had experience with. So much of what is done for that child, fix the lip, fix the palate, do a pharyngoplasty, is for a child's speech. The speech is, and the speech pathologist is premier in working on that team. So there was that feeling that the speech pathologist, and especially a knowledgeable speech pathologist, a competent speech pathologist on a craniofacial team, just had loads of respect from craniofacial surgeons, from orthodontists, from dentists, and that was both, it was impressive to see that. It was nice to know that speech pathology could be just so important. And I think in retrospect, it's one of those things that made me develop my clinical skills that much more. At Children's, we have a wonderful working team. And one of the things that they like is that I help give them more visibility because I have been out, this is not my first rodeo, and I've got a lot of friends nationally and internationally, and I can hook up our dentists and orthodontists to specialists. And if they're going to do any research, I know the ropes. I know how to get things published that maybe they didn't. I'm working with a bunch of workaholics. Our administrators should have the easiest time in the world. All they have to do is make sure the lights are on, the doors are open, and help get patients in and out. And that part is very rewarding, to be working with a group of people that have the same kind of passion that I do.
You also talked about your publications and the importance of keeping really good records if you ever want to present at ASHA or do any kind of publication in a journal. What kind of advice beyond that would you give in terms of, you've talked about some of your early research coming up with a nice, simple, and elegant, well-designed study. What kind of, not just to researchers out there, but also clinicians, what kind of advice would you give for a clinician or a researcher wanting to kind of get something published that they're working on?
I'm going to tell you something I learned from Jim Hecht. Jim was our radiology tech at Lancaster, and I'd asked him to developed some film for me, because back then there was no PowerPoint, and I had found a way where you could take this high resolution Kodalith film and he'd run it through the X-ray processor for me. I knew he was busy, and he knew I was in a hurry, and he looked at me and he said, "Doc, you know, if you need something done in a hurry, you just find the laziest guy you can, and he'll show you the fastest way to get it done." And I've lived by that for some things, but being lazy makes you think about how you can do things once and use it many, many times. And you can only use data over and over again if you've collected it accurately. So one of the things, and I call these survival skills, like most students come out, they can do Word, they can do PowerPoint, they may be able to do Excel, learn to do a database. Otherwise, you're going to be fudging a database into Excel, and it's not graphical. It doesn't work like a database. So the first thing, every bit of information we have, in fact, the hospital system actually fills up 100 fields of information, demographic information. So we don't have to go searching for date of birth, this, that, or the other thing. And then all of our databases have cells where we put in information on the nasometry. We, through the Cleft Palate Association, have a rating scale. So we're rating resonance, hypernasality, and hyponasality, nasal air escape, articulation, and so on. So that we have that information. When we have questions, the first place we look is our database. When somebody asked me up, when Dr. Broder called me up and said, you know, I want you to participate in this study. How many patients do you have that have this kind of disorder? How many surgeries have you done? While she was on the phone, I said, you know, 150. What were their ages? Well, I've got that too. So learn survival skills, where you can put information in once and then use it over and over again. But if you're going to use it over and over again, you have to be exact in putting it in.
Right. Accuracy for sure, and then come up
critical.
with a great way to keep things over time,
Critical.
rather than just paper
Yes.
folders to have to flip
Yes.
through
Oh,
and
yes.
try to
Yes.
reorganize it. Wonderful. So the last question I have for you that we asked you to prepare a little bit for was to sum up your take-home message in 6 words to answer the question, what is the message that you would like to send to current and future generations of clinician researchers in your field? Do you have?
Those 6 words are stuff brain with knowledge, give away.
Stuff brain with knowledge, give away. Would you like to expand on that a little for us?
That is with all respect to Leo Biscaglia, who is a great educator. And one of my first fellows at Duke had finished up her fellowship. She happened to be a fellow Gator, and she was an interesting young lady. I've never had anybody be able to finish my sentences the way she could. It's like we never had a complete conversation, but it was always like we were just in sync all the time. Terrific, a terrific clinician. And when we were done, she gave me a little plaque, still hanging on my office wall, from Leo Biscaglia, and says, you know, basically the education is not just to learn all these facts. You know, it's to fill your head with knowledge and then give it away. That is, pass on the torch. Whether it's clinical skills, whether it's research skills, whether you're helping the next generation, but give it away.
Well, that's wonderful. I think that's something that, you know, we've talked so much about the mentorship and what students and new clinicians going out into the field are looking for. It's for people who are going to teach us and give away their knowledge so that we can, you know, continue to improve the field. So thank you so much for joining us,
welcome.
Dr. Riski. It's been a pleasure speaking with you.
Thank you.